HIV/AIDS ambassador and the UN peace messenger, Charlize Theron's speech has caused quite a stir, not only on social media, but has given fuel to much-needed debate on why it is that we're not able to eradicate HIV/AIDS with all the tools in the world, medical research, and also funding that has been given to this particular cause. Of course, the reaction or criticism being that denialism around primarily whether race or racism and discrimination causes the environment that perpetuates the HIV/AIDS infections. To help us with this debate, we joined in studio by Dewa Mabinga. He is a Human Rights Watch senior researcher. Steve Mabona is the spokesperson for the MEC for Health in Gauteng. And Pina Godisang is the executive a programmer for Soul City Institute. Dewa, thanks so much for joining us. Just reacting on why we haven't dealt with the HIV pandemic, particularly as it impacts largely the African continent and black people more specifically. So what is the correlation between racism and discrimination when it comes to HIV and AIDS?
The clear factor here is that of discrimination, in that if the big population that is affected by HIV/AIDS is the black population, you need to look at the issues of the practices and laws that discriminate presently and historically that have fueled HIV/AIDS. And not only that, but also in terms of access to resources. So we are looking at a number of groups. So discrimination is not just for the black population, but there are other vulnerable groups, including sex workers, for example, who are also equally affected by discriminatory practices and policies. So what needs to be addressed is to look at scientific, evidence-based approaches that say how are the different groups affected differently by HIV/AIDS.
Let's just ask the spokesperson for the Health MEC, that's Steve Mabona, whether this is just purely a coincidence that the black majority in Africa would have the highest infection rates, or do you think that discrimination indeed is the catalyst that perpetuates this particular pandemic?
What you focus on is the risky groups. That's what we have learned, that those are the people that have been discriminated. You're talking sex workers, you're talking LGBTIs, you're talking men that are sleeping with other men, and we're speaking about men that during the day they are men and they claim to be straight, but come at night they will then sleep with other men. So all those risky groups have been identified without looking at any race, because you find that across the races. So when you look at the HIV and AIDS, including TB, you don't focus on race, you focus on the risky behavior and the risky groups that have been excluded.
Pina, maybe you might have a different perspective. If we look at historical racism and injustice that had marginalized, disenfranchised by primarily black majority, not to have access to quality education, not to have access to the ability or the propensity to want to fend for yourself, in that the choices that are still being made is based on that historical injustice. Would you agree with this?
I actually differ slightly with my colleague here. I believe, the HIV infection rate has a lot to do with race, because it has a lot to do with poverty, the socioeconomic, status of people in South Africa. And if you look at statistics, you will know that 12 million people in South Africa live in poverty, and most of the people who live in poverty are black people. So, of course, when you talk race, we're talking differences between black and white people. So for me, I believe that there is a link between the poverty rate that we have in South Africa and the HIV infection.
All right, so now when we say, especially quoting Charlize Theron, where she says it's the racism that allows the white and the wealthy to exploit the black and the poor and then blame them for their own suffering. And this was, of course, met with wild applause. How then do we conscientize every stakeholder to deal with the issue at the level of injustice that still exists based on what we've inherited as a country and a continent?
I think the best thing is to use a rights-based approach that is holistic and looks at the historical factors, and even in terms of the responses that are then given in terms of allocation of resources, you need to look at that broad range of where are we coming from as a people and what are the best interventions, and not a simplistic blame game. So a rights-based approach would help to address these issues and to have a proper response that addresses and targets the vulnerable groups and populations in a way that takes the country forward and Africa forward towards eradicating HIV/AIDS.
Let's just speak to spokesperson of the MEC for Health, in that if your life had always been regarded as that of deprivation, or you are subhuman, or you're second grade, and that had been perpetuated from one generation to the other, that you're likely to have the inclination or propensity to make better choices. Plus, the culture of rape, as Charlize Theron was talking about, the culture of objectifying women that we still see being manifested. One can argue that it is indeed about discrimination or injustice and, for that matter, racism.
No, but we also need to look at the fact that who was oppressing who. I mean, government has made some strides in making sure that we address the issue of access to the treatment. And as such, I mean, there's a lot of improvement that has been made, without taking it away the issue of where we come from. We cannot base our premise on where we come from, talking pre-1994 or around 1996. Now we are in the 2000s, and we have made some strides. I mean, financial backing, government has availed more funds to make sure that we avail access on treatment, access on making sure people know how to prevent, because we are moving towards prevention, making sure that all the preventative mechanisms are being addressed. I mean, the National Department of Health has announced that they were given an additional 1 billion, to focus on HIV and AIDS related issues.
I'm sorry to interrupt you, Steve, but the political denialism, when we say that the manifestation of apartheid, colonialism and slavery, that it will take us many more generations to be on equal footing as the different racial groups, and that now we're denying that there are indeed manifestations of the oppressive regime that we're still experiencing today. Lack of the quality of education, lack of access to adequate health care, lack of all sorts of things, that the discrimination or injustice still exists. I'll have you respond, Pina.
I would like to come in. I think we appreciate the strides that have been made, and no one can deny that we have actually come a long way in terms of the fight against HIV in South Africa. But I would like to go back to the point I made earlier, that we have young women, and I'm not excluding the young men who are also living in these communities, but the reality in South Africa is that we think young people have access, but young people do not have access. If you go to the grassroots, if you talk to young people and you ask them what access means to them, it's different from how we define access. I think we define access as having clinics, but can young people go to those clinics and get a service that they require is something that we need to work on. If we talk access in terms of saying resources are there, do young people in Ntuba have access to those resources? How are we making sure that they know about those services, and not just only know, but that they are part of making sure that those services are improved for their benefit?
Are we continuing the environment, or the conducive environment, in valuing more lives than others, as per the quote of Charlize Theron, valuing men over women, white skin over black skin, the poor over the rich, etc., that we have the tools, if we were to investigate. This is a human-engineered virus. If you go with the conspiracy theories, that 35 years down the line, surely we should have had a cure for it. What is your view?
Yes, there ought to be, more concerted efforts to say how do we eradicate AIDS globally, and it's not an initiative or effort for one group or for one country, but it's a global effort. So it has to do with the allocation of resources and the coordination in getting the resources together. But beyond the resources, there is the Global AIDS Fund. We are also looking at, ensuring that the laws that exist are not discriminatory, and that we always are looking back to say, where have we come from? What historical issues do we need to address? And today, which populations, on the basis of scientific evidence, are the most vulnerable, and how can we put targeted support to those groups?
Yeah, Mr. Mabona, I mean, this speech by Charlize Theron almost gives credence to what former President Nelson Thabo Mbeki had spoken about regarding HIV and whether it causes AIDS or not. I don't want to go into the merits of it, but essentially saying that you need a multi-pronged approach to it. Genetically, if you are not eating well, you don't exercise, you don't have access to proper health care, etc., that your immune system will deplete. It's not just the medication in itself being the silver bullet. Do you think this correlates pretty much with Charlize was saying?
Look, like as you said, we're not going to go back to the former President Thabo Mbeki's statements. I would like to put an emphasis that government made some strides, and the Minister of Health has considered to say, looking forward, this is what we have done in terms of making sure that we improve the situation. Access, it's given to all, the patients or all people who tested positive. They are put on drugs, and you will know that now with the effect of the announcement that if you come, we test you, and we realize that you are positive, you're going to be, administered.
So if we say that on all spectrums of society, there are poor people generally, regardless of race, why then is it more prevalent amongst black people?
I would like to come in.
We are majority. Black people are majority in the country. Like as I'm saying, I mean, we providing education now. We are targeting even schools, making sure that we go to schools on each and every Wednesday. We target schools and make sure that we educate, we do necessary testing, make sure that we identify any ailment that might come out of the school children at that primary level. So that's what we are doing as a country and as a province. So we are making sure that we change the scenario. Hence I'm saying the issue of discrimination, we cannot put an emphasis on, because as government, we are making sure that there's access, looking at the socio-economic environment, there's social development that is focusing on making sure that there's availability of social grants,
okay,
looking
Mr.
at
Mabona,
all the categories.
Just let Pina respond in terms of the impact of socio-economic issues that still plague, that are perennial in many communities, even as you deny as the government. And we're not saying that progress hasn't been made. We're just saying that the reality, the majority black poor are the ones who are most vulnerable and susceptible to HIV/AIDS. And that in itself is an injustice. It is discrimination. Pina.
Okay. Yes, I wanted to come in earlier. But look, I think let us agree that we have made progress. But I think one way that we can actually achieve even more is to acknowledge that there's still a lot to be done. So we're not sitting here saying nothing has been done, because we know that a great deal of work has been done. But I think if we continue to deny that, we still have a lot of our young people. I mentioned earlier that 12 million people in South Africa live in poverty. And I also mentioned that 17%, of young women are living with HIV and AIDS, as opposed to 5.7% of young boys. So you are dealing with issues that go beyond young people accessing services. That is why these days we have trends that are going, because young people are actually saying, this is our way of crying out for help. These blessers and all these phenomena that are out there, young people are tired of living in poverty. They are trying to find a way out. It's unfortunate that in them trying to find a way out of poverty, they end up going back into the cycle, because of course if a young man like yourself, who looks as handsome as you do tonight, comes and flashes material things at these young women, and they live in poverty, they will definitely take you on your offer. And of course, we know from research that has been done that the offer is that you give me sex and I'll give you money. So we can't deny that we have a situation that needs to be resolved. And we need to empower our young women with economic development. You know, we need to move beyond providing treatment. For me, I think we need to catch them before the onset of disease. So let's not wait for them to be positive and come with treatment, but rather how do we prevent them from getting infected.
Now, we saw Premier of the Western Cape, Helen Zille, responding to some of the comments or the extract from Charlize Theron's speech, saying that applying scientific information is what's lacking in influencing sexual behavioral change. And I'm paraphrasing, but in the context of, again, the deprivation that people are living in, not only in South Africa, the continent-wide, the vulnerability, the oppression thereof. Can we really say that this is a lack of admission or denialism from politicians to say, well, we have scientific information, the only thing that's lacking is the application thereof?
Well, it's a number of factors, but worryingly, you know, new HIV infections are going up every year, and nearly 2 million across the globe. And it's a number of factors that contribute to this epidemic continuing to rise. And one of them is certainly the lack of political will. Yes, there is scientific evidence, but what is needed is to target vulnerable communities and to say, why is it that we see a rise in these different populations? And we have said one of the things is discrimination or criminalization in some of these sectors, but also the need to put resources. Governments should commit to resources towards ensuring that there is an eradication of this epidemic. So the question of political will is also reflected in the amount of resources that are committed to fighting the epidemic of AIDS. And it is not clear that there has been such commitment at various levels, say at regional level, at country level, at continental level, and globally. How is the burden being shared in terms of mobilizing resources and deploying them appropriately to the most vulnerable communities?
And how do we deal with these negative stereotypes of the black self-imagery, that rape is a culture within the black community, that women are being objectified and therefore be treated as objects of pleasure, and that even with certain rights and practices of polygamy, that women at the end of the day, primarily black women, are being unfairly discriminated against when it comes to the prevention of HIV/AIDS. We'll ask Mr. Mabona to explain.
Look, let me start by saying I'm not sure when Fina is talking about denialism, what is she referring to? Because as government, there's no way we denied. And sitting here, I have not denied that there's poverty. What I said we made some strides, and we will continue to make sure that we change the socio-economic environment of the country and of Gauteng, because I'm talking for Gauteng. And we'll just make sure that we change the environment. Like talking about if we go to statistics, I mean, in Gauteng we know 65% of the population there know their status. And out of the 65%, about 68% is on treatment. And those that are on treatment, about 78%, the viral load has been suppressed. And we're working with all the stakeholders. I'm talking about the risky stakeholders that have been identified, your LGBTI, sex workers, men that are sleeping with other men. In the Gauteng AIDS Council, we make sure that there's a fair representation, and we came with them here as the Gauteng AIDS Council to come and learn and make sure that they attend all the sessions, so that when we come back, we're going to be sitting with them and strategize on how we're going to move forward, improve, make sure that we change the scenario. I mean, we have a session tomorrow where we will be talking about sex. Our theme is Sex in the City. We'll be talking about the truths that people don't want to hear. I mean, we experience a lot of migration as Gauteng, and how do you start by making sure that you address all the issues, all the factors, making sure that everyone that is represented in the sector is addressed. So that's what we're going to be doing.
All right, I just want to ask, Deva, just based on what Mr. Mabona was saying, in that you already have a title, and I'm talking generally as the global community when it comes to HIV/AIDS, that they are risky stakeholders, that the LGBT and homosexuality, etc., that you now only engaging the so-called risky stakeholders. Isn't that in itself discrimination? Because again, we're saying that straight love in the speech is better than gay love. We're saying in the speech that men are better than women. And that perpetuates the HIV being prevalent.
Absolutely. That is in itself discrimination. And what we're saying is that we should, governments, authorities should disprove Theron's words that some lives are more valuable than others by making sure that no one is left behind, and by not saying perhaps this is better and that is better, but by ensuring that there is a comprehensive response to HIV/AIDS, which does not leave anyone behind, but which also deploys resources equally to all communities, but considers the historical aspects in terms of justice, in terms of discrimination, and ensures that the laws in place are the right laws that do not criminalize, but that make it possible for people to be tested, for people to get treatment, and for people to have easy access in terms of cost to drugs that they need for their lives.
Yeah, so Pina, how do we deal with that stereotype and stigmatization of the particular groups when it comes to what we perceive to be somebody who is susceptible to HIV/AIDS, suggesting that there's a certain grouping that is more promiscuous than others? We know that HIV, you can contract it through a blood transfusion. It doesn't necessarily only happen through a sexual conduct. So how do we rid society of these labels, just starting there?
Can I come in?
Yes, sir.
I'm saying this is not discrimination. It's inclusivity. Make sure that you address everyone, because they've learned previously that if you don't talk to everyone, how are you going to manage to win this battle if you discriminate and don't address everyone? So the decision is to make sure that you are inclusive in anything that you do. Call all the interested groups and seek advices from them, because there are people who will say, yes, we are this group, and we have such a number of people that belong to us. So what do? You make sure that you put them in one room and get the inputs from them on how you're going to address issues. Like, for instance, people who are injecting themselves with drugs. We know, we go and target them in those areas and make sure that there's no reinfection, avail the injections so that they utilize those injections, because whether you like it or not, they are doing it. So what do you do?
All right, let's ask Pina to respond to that.
Avail those injections and make sure that there's no reinfection.
Yes, Mr. Mabona. Let's give Pina a response when it comes to discrimination and stigmatization. Yes, ma'am.
Okay. If the target we are trying to reach is to get to 0 new infections, I think we are going about it the wrong way. We have a cohort of young people who are not infected yet. And with whatever intervention that we are doing, I still believe we are missing them, because, and that's why I agree with you that we've made strides, we've put treatment, South Africa has the largest treatment program in the world. That's applaudable. But I'm talking about those that are not yet HIV infected, those that are living in poverty, those that are excluded from participating, in the mainstream. And it's those that we still, I think you and I are not agreeing on that one, we're still excluding, because we will end up counting them as a statistics once they are HIV positive. Whereas if we try to cap it and get them before they are infected, and that's why I'm saying programs on the ground are responding to that effectively. You are talking beautiful statistics of how many people we've put on treatment, but my worry is those that are not yet. Do we want to wait until they're infected and start counting? Now we've added another 1,000 on treatment, because if we don't do it right now, we are too late actually. You know, we should have done it, and that's what I think the gist of what was said at the opening when Charlize spoke. It was around, we keep excluding, and maybe calling it discrimination or racism becomes a political debate, but we keep excluding those that we need to focus on in terms of making sure that they don't get infected. And how do we prevent them if we don't have programs on the ground? We have a lot of beautiful programs such as the RISE Young Women's Clubs, where we equip young women with education around how do you prevent. But if there's nothing that spreads to other provinces where we do not reach, you know, as Soul City, who else is speaking to these young people? It's blessers, it's people who have money, it's people who young people you know, aspire to look like. So we are really failing our young people.
Okay, let's ask the researcher, Deva Mavivinga, senior researcher, Human Rights Watch, just to contextualize it again when it comes to the fact that based on your environment, your predisposition, and now we have child-headed families because of HIV/AIDS, you know, depriving them of a healthy household, that now that generation becomes the victims, and it's not because of their own choice or their own doing. It's the circumstances that they find themselves in, and the rest of the world is turning a blind eye as if it is their destiny in life.
Yes, and you're looking at, you know, trying to connect the dots to say when you respond to an epidemic like HIV/AIDS, you don't look at just one portion and think that you have a solution. You need to look at, you know, the different aspects and bring them all together. So you are looking at the environment, you are looking at the social environment that the generation is in, and how to ensure that everyone is empowered in terms of resources, in terms of information, in terms of access to education. So if you're looking at the girl child, if she is left out, he's more likely to be in an abusive relationship, more likely then to not have access to medication and things like that. So responses must be comprehensive, must be holistic, and governments should not look at piecemeal approaches or silo approaches to say we are dealing with this compartment and not the other. So you're looking at the legislative environment. The laws must be those that take out all forms of discrimination. The resources must not discriminate. The access to information, all different populations should have access to information. So how you disseminate that information is also important for different population groups.
All right, we're going to leave it there. Deva Mavivinga, senior researcher, Human Rights Watch, and Steve Mabona, spokesperson for the MEC of Health in Gauteng, and Pina Kodisang, executive programmer for Soul City Institute. And that was our debate. You can continue on social media. That's at ANN7 at ANN7 TV. We'll be back after this.